As we quickly approach Boulder Community Health's 100th anniversary in 2022, I often reflect what has been accomplished over our long history. Literally thousands of people have been part of BCH during those decades of growth and development. Different eras, different challenges, but all sharing a fervent belief that our community wants and deserves a health system that reflects and supports Boulder values. All recognizing that the key to being Boulder is being independent. Maintaining our independence has not gotten any easier. Today's challenges include constantly changing federal and state regulations, incredible financial pressures from payers, relentlessly rising costs. Yet the BCH Board of Directors remains confident in our ability not just to survive, but thrive. This has been made possible through the Foundation, our physicians, nurses, and many others who choose to do this work each day across BCH. Your support of the BCH Foundation allows us to invest in high-quality medical care, pursue opportunities to evolve and innovate, and to lead with advancements in healthcare. This work is fueled by the deep bench of champions throughout the community who advocate for us in so many different ways. Whether it's investing in expanding access to critical services or igniting partnerships in support of our vision, the BCH Foundation has successfully catalyzed the generosity, advocacy, and talent of the community to support the personalized care that truly makes us unique amongst our peers. Thank you for all that you do to make this work possible. Your investment in the future of Boulder Community Health is making a difference.
Hello, I'm Grant Visser. I am the president of the Boulder Community Health Foundation, and I am excited to have you join us this kind of cold and snowy evening, along with close to 500 individuals across Boulder County, and I guess since we're in a virtual world here, maybe much further. I appreciate everybody coming to be part of one of many engaging conversations that we have planned throughout 2021 as we bring you the new BCH Foundation series, Elevate. In short, our goal with this series is to introduce conversations around critical topics shaping the future of healthcare in our community. And I guarantee you that our conversation tonight with Attorney General Phil Weiser and Dr. Robert Vissers will be sure to be that. They're going to be discussing many topics ranging from actions being taken regarding the COVID-19 pandemic to a hot topic around protecting vulnerable hospitals in our state, and also working to drive down healthcare costs. That and many other topics will be discussed. I wanted to add a few quick housekeeping tips here. One, if you're having any tech issues, just chat in or use the Q&A feature and somebody will answer that for you. We're going to have Attorney General Weiser and Dr. Vissers they're going to speak for about 30 minutes in total. And then we're going to jump in with a Q&A at the end of the evening for about 20 to 25 minutes. So as we go, if you have a question you want to ask, just put it into the, I guess either the Q&A or the chat function. And I will be sure to try to go through as many of those as possible at the end. So without further ado, I'd like to introduce Dr. Vissers, who is the CEO of Boulder Community Health and also happens to be my boss. Boss is known as a healthcare leader in the industry as a whole. He's very much grounded in 25 years of frontline practice as a emergency medicine physician. Rob joined Boulder Community Health back in 2014 as our chief operating officer, and quickly became president and chief executive officer in 2015. Prior to BCH, Dr. Vissers was at Legacy Health, a nonprofit health system based in Portland, Oregon. Rob actually comes to us from the north in Canada, where he received his undergraduate studies and his MD at the University of Western Ontario. And he completed his residency in emergency medicine at the University of British Columbia. He also has his MBA from Oregon Health and Science University, which is located at Portland State University. Rob's also been on the faculty of Harvard University, University of North Carolina, Oregon Health Services University, and is currently on faculty at the University of Colorado Healthcare as part of their executive MBA program. So without further ado, I'm going to turn it over to Dr. Vissers to introduce Attorney General Weiser, and I will be back with you in about 25 minutes. Thank you.
Thank you, Grant. And I will take a minute to introduce Phil Weiser, our 39th Attorney General of Colorado. As the state's chief legal officer, Attorney General Weiser is committed to protecting the people of Colorado, defending the rule of law, building a Department of Law that serves all Coloradans effectively. But I think what you also find out that it's here to serve and support the health and the wellness and well-being and protect the health of Coloradans as well. If you'll indulge me, I'd like to go on and talk a little bit more about your background, Phil. You are so much more than just the husband of Dr. Heidi Wald. That's how I know you. Very impressive, and clearly public service is one of your core values. I was a professor of law, dean of the University of Colorado Law School, where he founded Silicon Flatiron Center for Law, Technology, and Entrepreneurship. Phil also served in senior leadership positions in the Obama administration, was appointed to serve as Deputy Assistant General, Attorney General in the U.S. Department of Justice, and a senior advisor for technology and innovation at the White House's National Economic Council. Earlier in his career, Phil co-chaired the Colorado Innovation Council and served in President Bill Clinton's Department of Justice. And after graduating law school, he worked in Denver for Judge David Abel. Is it?
Ebel.
And on the 10th Circuit Court of Appeals, and he held two clerkships at the United States Supreme Court for Justices Byron White and Ruth Bader Ginsburg. How cool is that? And Attorney General Phil lives in Denver with his wife, Dr. Heidi Wald, and their two children. Welcome.
Great to be here, Rob. Thanks for all your leadership.
Thank you. Well, we have a lot of topics that we'd like to touch on and a short period of time, and I do want to make sure we have time for people to chime in with questions. And so I think we have to start with what I think every conversation in 2020, or at least the latter half, starts with, is COVID. And I am interested in hearing what you have done or participated in terms of helping us manage through this pandemic, especially even now as we start to see light at the end of the tunnel, but some of the challenges we continue to face.
Rob, when I ran to be Attorney General, I was not thinking that my job was going to be significantly and sometimes primarily a public health job, but it is. We're going to talk about a range of issues today that are front and center on my agenda. And as you said in my introduction, it's about the health and wellness of Colorado. And obviously the pandemic is central. I didn't know before 2020 that our office had a role in enforcing public health orders. This is something that people like yourself and my wife Heidi think about: public health. How do you communicate to the public what safe behavior looks like? In a pandemic, that communication is central. And unfortunately, for much of 2020, we didn't have effective communication from the national level. So how we operate in Colorado made a huge difference. And I wrote a piece in Law 360 about this. One of the things we quickly did is get the word out that the enforcement of public health orders needed to be more about social norms than about putting people in jail. The truth is, there are criminal sanctions for violating public health orders, but those are only for the most extreme cases. What we need people to realize is we're all in this together. And so what we work to do is develop the messaging so that in Gunnison, for example, where I was, this summer, they have this great messaging campaign that says, help us keep business open, please wear a mask, please keep social distancing. And so we worked hard, yes, to enforce public health orders. We had sometimes you had to shut down shops that were not following the rules, but a bigger part of it was communicating that there is a broad shared commitment that we're in this together. And one of the things about Colorado that I value so much is that collaboration between the state and local levels. And so we continue to work with public health departments around the state. A second area that is relevant to this conversation is communicating around the scammers who would tell people, I've got a cure, or I've got a treatment, it's FDA approved, except they were lying about it. And a lot of people fall victim to scammers when they are desperate. And so we worked hard to communicate, don't fall for these scams. If you have been scammed, go to stopfraudcolorado.gov, report it. we can look into it. We can take action. We took an action this week against a medical supplier that was engaging in both price gouging and deceptive marketing. That was a whole other new deal that we had to take on during this pandemic. And so we have a number of roles that we've played around public health, around protecting people from fraudulent cures. And obviously we had to do all this while working remotely so our team members could be safe. And that was something we did on a dime as well.
I will say that it wasn't just us as healthcare leaders or as legislative leaders, but the entire community and every individual in Colorado, we were hungry for clearly defined communication. And I will say that every state has been challenged with this, but when I spoke to other states or colleagues across the country, I think it is fair to say that Colorado was a leader, and we were fortunate to have at least clarity in our messaging. And boy, you certainly realize the importance of public health, but also it's not just what we're doing in public health, or it's not just providing some of those preventative measures, but it's how you articulate that to the entire community, getting us all to work together to not just take care of ourselves, but really it comes down to how we're caring for others, how our actions can literally save the lives of others. I spent most of my career as an ER doc trying to save lives at the bedside one at a time. And when I think about how just a clearly communicated mandate or request or a conversation around a social norm can just save thousands and thousands of lives. And we did see that in Colorado. So thank you for that communication and highlighting the importance of that.
Yeah, I'll put in the chat for all attendees the article I mentioned. And this is something that, again, we in Colorado, we can't take this for granted. We've got this collaborative spirit that we're in this together, and that we're all trying to work together on a range of issues around health and wellness. We'll talk about that throughout this conversation. And I don't want us to take it for granted. It's a model of what the United States should look like, but we have a lot of division right now that gets in the way of that. I'm really proud of how Colorado has risen to this challenge.
Any other aspects of managing through this pandemic that you want to highlight or share with the audience, Phil?
There are a couple, Rob. And another point, I mentioned public health. I would not have thought before becoming Attorney General how much of my job is about mental health. Yeah. And one of the elements of the pandemic is the intersecting crises. I know Brad Feld's been a big supporter of what you guys are doing on mental health. There's a pandemic. That's a crisis. It's a once in a century health crisis. There's an economic crisis that has fallen out of that health crisis. The impact on small businesses across the state, on people who are in service jobs where they lose their jobs. One person said it well, we're all in the same storm, but not all in the same boat. Some people are in yachts. Other people are barely in a life preserver. And then related to this, of course, this summer we had issues around racial justice, and that affects healthcare as well. That is a reckoning that is important for our society. It added stress and strain. We've had a climate crisis that manifested in Colorado with the wildfires that we saw. And also all of those with a mental health crisis, which of course intersected at a time that we've had a election and democracy. You could call it crisis because it got to some pretty difficult moments. Amidst all of that, that is taxing. That's straining on our mental health. I know people are having a harder time sleeping at night. Alcoholism has gone up. Substance abuse has gone up. The lack of in-person connection. So the other thing I would want to say is, in addition to all the physical health issues that we've been dealing with, we need to recognize the mental health strains that the last year has put on us.
Yeah, I absolutely agree. And unfortunately, Colorado is not unique. The entire country, however you measure, whether it's domestic violence, substance abuse, suicide attempts or suicide, child abuse, unfortunately, all of these things have accelerated over the past year. And, it's not hard to understand why. When I think back to leading into this pandemic, and you look at things that were top of mind for us within healthcare, obviously affordability, which I think we should try and spend some time on, But we were also very focused on another pandemic that was affecting our state and our country, and that was the opioid crisis. Don't hear a lot of talk about it, but I can tell you that it hasn't gone away. And sadly, while we were making tremendous inroads, and I know that it's an area you're interested in, if anything, we've only seen an acceleration and an increase in the number of overdose deaths secondary to opioids.
So we could do this whole discussion about opioids. It is a topic I'm very passionate about. I will try to be as succinct as I can. Many people are not touched by this crisis. Most people know somebody who's been touched by this crisis, but there's some people, and I want you to know you're lucky, who says, what crisis are you talking about? And the crisis is unique to this country. Over the last 20 years, we have lost in Colorado, I think around 5,000 people from overdose deaths. Obviously, you run those numbers across the United States, but that's just the people who've died of overdose deaths. That's not talking about people whose lives have been destroyed by dependency and addiction, whose marriages were destroyed, who ended up in the criminal justice system, who lost jobs. That's hard to fully get your mind around how much damage has happened. And what happened in this country, which didn't happen in other countries, was the pushing of what should be very carefully managed prescription drugs that are highly addictive, but people were basically told to take them like candy. It was years ago when I broke my ribs and I got the x-ray, you've broken ribs, here's a 2-month supply of opioids. And I didn't ask for it. I didn't take a single one of them. I put them in my medicine cabinet. A lot of people do this. Now, my wife, Dr. Heidi Wald, she knows about this. She's worked on this issue to cut down on prescribing practices. She took those and disposed them properly. But what if my kids had said, oh, that's a party drug? Because a lot of kids will start with these prescription pills, which might seem harmless or fun. And then next thing you know, you're on heroin and you're homeless. And that is a story I've heard directly from people. And it happens a lot quicker than people realize. What we're doing in our office is we're going to hold these companies accountable. For those who don't know about the Purdue Pharma story and the Sackler family, who's made a lot of money from that company, they need to be brought to justice and held accountable. And the money that we get is going to then be brought into education efforts, prevention efforts, drug treatment efforts, and drug recovery efforts, a lot of which have this interface with the criminal justice system, because what we have done in the face of this crisis is often have people sit in jail is not a solution because they've got a public health problem. And then when they leave jail, having effectively gone through detox, their system's off and they're much more likely to overdose. So we're on this path. I've hired Heidi Williams, who's a former mayor of Thornton, to be our director of opioid response. We're working in the same spirit of collaboration I talked about. It's going to be statewide, regional based, to start bringing these better solutions to bear and to turn around what has been in our nation an incredible, painful chapter that we're a long way from addressing, Rob. As you say, it's gotten worse during this pandemic and people have taken their eyes off the ball.
Yeah, I can tell you that. And first of all, thank you for those efforts. And it's another example of how we can save lives, thousands of lives, and not just life or death, but how it impacts their life and their ability to just stay at work and engage with the community, or as opposed to losing touch with their family. And there's so many other socioeconomic outcomes because of the opioid crisis. I can tell you that having worked in level 1 trauma centers most of my career, measure this in terms of not just the individuals involved, but how it affects everybody around them, whether it's a car accident, et cetera. Incredibly devastating and a difficult problem, and reaching a proportion that really was unmeasurable. I think between males between 35 and 45 in the U.S., it was the leading cause of death leading up to COVID. In fact, I'm sure it still is. We did touch a little bit on mental health, and there's a lot of overlap between that and the opioid crisis. I know there are a few things that you've been involved in to promote access to mental health. So that was one of the challenges we would face in the emergency department. Someone would come in with an overdose, or someone would come with a suicide attempt. We'd patch them up. We'd get them better, at least briefly, or stabilized. The hard part was either preventing them from getting there in the first place or getting them to some services on an outpatient basis to prevent just repeating the cycle.
Let me start by acknowledging that we have to destigmatize mental illness and we have to normalize conversations around mental health. Rob, you and I can remember the movie Terms of Endearment, where the stigma around having cancer played a leading part in the movie. And the Deborah Winger character at one point says to a friend, will you tell people it's okay to talk to the cancer? We don't think about cancer in that same way. People say cancer sucks. I have cancer. I'm getting my cancer treated. But people have a hard time saying, I'm struggling with my mental health, or I'm struggling with depression or anxiety. And this is something that I would say to all of us. It's okay to not be okay. What's not okay is to not have a safe place you can talk about it. This is the number one challenge, I believe, in parenting, is how do you create conversations? How do you support your kids to have coping skills? And talk about leading cause of death between 12 and 24 years old in Colorado, it's suicide. And we have a program called Safe to Tell, and we're trying hard to get the message out, and we've got a series of PSAs around this, not to have silence around this conversation, but to have people checking in on one another. And then if there's threats, imminent risks that someone is going to take their own life, Safe to Tell is a safe place you can go, anonymously share the information, so we can work with behavioral health professionals and others, people in schools, so that we can save lives. This mental health issue is critical. And the final point, I think this gets to a little what you're talking about, we've got a mental health parity rule here in Colorado and at the federal level, but it's not always followed. And our job is to make sure that it is followed, because mental health is healthcare. And we need to make sure we address it because it's critical to people's well-being.
Yeah, it might be helpful to explain to the audience what that mental health parity rule is. But I can tell you that there has been some tremendous effort on the federal level, but the enforcement and it's just not being manifest. And unfortunately, in Colorado, while we, I think, provide outstanding healthcare, and we truly are leaders as a state within a country that's a leader in terms of quality of care, we lag far behind in mental health services, both locally and across the country within Colorado, and some of that is attributable to the lack of parity that you speak to.
Let me add one more point too, because I know Paige put this question. I assume it came from somebody else. In both the opioid situation and the mental health situation, we are capturing these issues in our prison system, and it is a manifestly less cost-effective, less humane, and less public safety effective way. If you can work with someone and deal with the addiction, help them recover, they're not going to keep committing crimes to feed the addiction. But if you just put them in jail and then let them out and they go back to using again, you just have that cycle. And we need to provide smart public health solutions where that's really what the problem is. Same issues with mental health. A lot of people who have struggled with mental health end up in the criminal justice system, not getting the help they need. I know that Boulder had a real tight budget situation, but maybe with some of your leadership, Rob, and Michael Doherty, your DA, you managed to keep in place mental health diversion programs, which is so much a smarter way to address these issues.
Absolutely. I think back to your earlier point, the destigmatization, open conversations, and access to services that both can help prevent, but take that warm handoff of the patients that we may stabilize, but rarely leads to a long-term solution. All right, I'm looking down my list here of other things. We still have, I think, a little bit of time before we get to the questions.
We haven't talked about the Affordable Care yet.
Well, I think that's what I was going to go to. Why don't we talk about Affordable Care Act and you know, it's hard to talk about that without its impact on healthcare access to healthcare, which touches on so many of the other social issues we talked about.
So let me start with access. And the opioid epidemic, again, we're out of sync with most countries like us. They've not suffered it. Another area we're out of sync is access to healthcare. most majorly developed countries have said part of our social compact is we care about the health care of our citizens. What we've historically had with this law that I know you knew very well, EMTALA, is, well, if you're really in a painful situation and you show up at an emergency room, we're not going to turn you away. So that's a level of basic commitment. But that is a inhumane and a very ineffective way of providing healthcare to people. Let's start by providing everybody with basic healthcare, including preventative healthcare, so that people can live healthy lives. And that means giving people healthcare in a way that people can afford. And the Medicaid expansion, part of the Affordable Care Act, was a significant, both from an economic, health, and justice standpoint, step forward. They've evaluated, for example, when you leave prison, if you have healthcare, you're far more likely not to end up back in prison. Now, one of the real bummers, back to our earlier conversation, if you end up in jail, accused of a crime, you lose access to Medicaid. When I was at the White House, I get to ask a question of the administration. They talked about this First Step Act, which was the criminal justice reform. I said, that was a great step forward, but we shouldn't be cutting off Medicaid access when someone's in jail, because that means they're not getting their mental health treatment, their substance abuse treatment. It's not smart. And so we have to really work together to be providing access. Another point here that I know, again, you're very tuned to, is our rural hospitals have depended on this Medicaid expansion. If the Medicaid expansion were taken away, rural hospitals will fail. Yeah. That's a core part of their economic model. And rural hospitals are critical to those communities. A lot of people who live in Boulder are saying, oh, maybe I drive a little farther to another hospital nearby if we lost one of our local hospitals. But if the local hospital in some of the eastern Plains counties in Colorado closes, we're talking people driving hundreds of miles to the nearest hospital. That's a life or death proposition that hurts those communities economically and in a matter of health. So we are, in our office, all in to defend the Affordable Care Act. It's at the Supreme Court right now. I can walk people through the legal arguments if they want, but I'll tell you, the legal arguments are very weak on the other side. I believe we're going to win this case. And it's just unfortunate that this has been politicized, because it's really an issue about providing people with access to health care. It's a life or death issue. It's an economic development issue for our rural counties. And I wish it wasn't so controversial.
I agree. And, you can argue the merits and the success and the failures of it. But there's no denying that it has increased access to care for millions of Americans and thousands of Coloradans that did not have access before, that hopefully down the road prevents many of the things that we're talking about, including mental health issues, opioid crises, as well as general health. What's fascinating, I think, to think about is it's almost like a platform, and really we have an opportunity to build on it and to address some of the challenges that we face with it. And in fact, we still have opportunity to make sure that everybody has access to health care. We're fortunate in Colorado that our uninsured rate is low, but we still have hundreds of thousands of people that do not have access, at least to health insurance and coverage, and therefore health care. Again, grateful for defending that. And I can tell you from a perspective of a provider and from a health system, this was really instrumental in the overall well-being and health and wellness of all of Colorado, and certainly at least when it comes to access.
Rob, if I can double down, there's a second critical provision in the Affordable Care Act, and I love your platform metaphor to build on. It's the protection against discrimination for those with pre-existing conditions. And for years, people who had pre-existing conditions, diabetes, take one example, kids who had illnesses, their parents would be afraid to change jobs because healthcare coverage could be denied on what would be a life or death issue. And the Affordable Care Act stopped that discrimination, and that's a critical protection for consumers. Right now, consumers are still risking being charged too much for life-saving drugs. We did a report now about insulin, and we've been working on this issue with other drugs as well, going after price fixing among pharmaceutical companies. We want to protect consumers from being put in a situation that still happens. In the report we did on insulin, 40% of those we surveyed said they actually cut back on eating so they could avoid having their medicine. They engaged in essentially self-help because their medicine was too expensive. That shouldn't happen in the United States of America.
I think, well, we're getting some questions here, but maybe we'll leave that for the Q&A session, although some of it is tied to the rural communities. And we touched a little bit on the importance of the local healthcare entity and hospital or critical access hospitals, not just in providing health, but also it's really important to the economy. For some of them, they're actually the largest employer. But are there some things that we're doing to maybe further support the care that's provided there? And an example, at least I can see the potential around, is telehealth. We went from something we dabbled with but had some platform to within a month of COVID, 25, and at one point it was 50% of our healthcare visits we were doing through telehealth. And I can tell you from a healthcare system point of view, we're not going back. But I can also say from a consumer point of view, there are many of them that said, you know, this was a whole lot easier, or it saved time in the middle of the day, or I'm an immune compromised patient. I prefer the care being brought to my home. And telehealth even is so much more even than just a video chat like this, but it can even be care provided in the home. So really seeing COVID as an accelerant. Do you see this continuing, and are there efforts taking place to help, you know, make this easier for us, particularly when we think about those that really struggle to have access?
Rob, there's a lot I can say about it. Let me start with the foundational point. My background, as you noted, is in technology. And for the last 15 to 20 years, I've been working on promoting broadband access as a fundamental enabler of education, of healthcare, and economic development. That's something that's critical, particularly for our rural communities. During the pandemic, one equity issue, the digital divide, has reared its ugly head. There are people right now with kids in school who don't have access to the internet, whose kids aren't learning. The previous homework app, which used to hear about people doing their homework in a Starbucks parking lot or in a McDonald's parking lot, that homework app has now become an online learning app. We filed a petition with the Federal Communications Commission asking for money that usually goes to this E-rate program to go pay for individual people to get access to be online. We've also, through a merger agreement we had as part of the Sprint T-Mobile merger, are getting hotspots put out there for communities who need it. So I am totally with you. Telehealth is critical. So is e-learning, which we've also used during the pandemic, both of which will stay with us to some degree or another. It depends on having broadband. And so we need to continue to be vigilant about promoting broadband. And I'm with you in the sense that some people aren't going to go back. I had an experience of my daughter getting a visit that was done this way. It's more convenient. I have worked in my office now using more teleworking, and we're not going back on that either. We're going to change how we work. So I think there's a lot of learning that can come from the pandemic. It's been an extraordinarily painful, awful experience to go through. There will be some benefits on the other side.
And great news. I think the potential is just tremendous there. Grant, I see you pop up.
Well, it's telehealth, so I'm jumping in for tele-educate with my, with Dr. Vissers and Attorney General Weiser here. So yeah, if you guys don't mind, I'd love to ask some questions that are coming in from the audience.
As long as Rob gets the hard ones.
I got a few hot seat ones for you on it. So one, actually on that topic, a hot topic, with everybody right now is around COVID vaccinations, right? And at BCH, we've been busy vaccinating the community, starting with our healthcare workers, then a lot of our front lines, teams such as, City of Boulder Police and Fire and Rescue and EMS. And then we've been quickly kind of moving our way through the 70+ demographic. And I think we've done over 10,000 doses in total. Our biggest constraint, and I think the headline for everybody right now, is supplies. So there's a lot of questions coming in, and maybe a two-part question. One, what do you see happening at the state level to further remove barriers to rapid distribution of the vaccines? And then two, how are you thinking about that from a health equity point of view, ensuring access to the vaccine to everybody from an urban and rural point of view.
So Rob, you're deep in on this. Maybe I'll start with the equity point and then you can talk a little bit more. Because someone asked the question, it may have come to me privately, how have we faced equity issues in healthcare during the pandemic? And there are a couple of answers to that. One will be the vaccine point I'll get to in a minute. I think people here mostly know that the issues around race come up in a variety of contexts. We've had a lot of discussion about the criminal justice system, in the education system, in the healthcare system. The question is, do people get treated differently based on their skin color because of implicit bias? And for those who think the answer is no, look at just the data on African-American women and white women's health risks during pregnancy, and then listen to the story that Serena Williams went through. And implicit bias is real. The data shows it. People's lived experience shows it. There are concerns, and there's data that shows the impact on mortality has been skewed during this pandemic. If you are an African American, you are more likely to die during COVID than if you're a white person, and that is a equity issue. The vaccine equity issues you've raised, I would put in two camps. One is on racial lines. One of the painful points is that African Americans may opt out of getting the vaccine because of a very ugly history of African Americans being experimented on without their knowledge. People have heard about the Tuskegee experiment, I think was the famous one. And what I think all of us can do is help, again, encourage people to be able to look at the science behind this vaccine, and for medical professionals to make sure that we're not allowing inequities to perpetrate themselves here. I know some of my African-American colleagues, fellow AGs, have made a real point of talking about them getting vaccinated. So did Vice President Kamala Harris, all to get at this impact, which, again, it's not that the healthcare providers are doing anything unequal here, but if people are opting out because they don't trust it, and then they're more likely to be negatively affected, it sort of plays off of that ugly legacy. The other risk is rural, and here a challenge is, particularly, again, Rob will help me on the science, these vaccines are not easy to manage from a supply chain, from a storage standpoint, from a distribution standpoint. And so that may lend itself also to rural areas being less well helped. And that's particularly painful from an equity standpoint when you realize in Colorado, 4 of the 5 counties with the highest rates of per capita COVID deaths are rural counties. The number 1 county in Colorado for per capita deaths is Crowley County. They are in the top 10 nationally for per capita deaths. I can talk more about Crowley County if people want to hear the backstory. It is a point of pain. The opioid epidemic has really hurt that community. They don't have the agricultural economy they once did because their water rights were sold. We can't abandon our fellow Coloradans during this time. And so how do we address it is the hard question, Grant, given the constraints I mentioned. As promised, I'll let Rob answer the hard questions.
How we address it. Well, I will say that there are many things that COVID has done for us, and some are very positive. But it also has exposed some real vulnerabilities and challenges that we have within our healthcare system. One is, if you're critically ill, there's no better place to be than most places in the United States. But again, it depends where. But the care can be fantastic. However, our public health system and our preventative care and our ability to organize nationally or federally is certainly lacking, and that's been exposed. And it also has, if anything, highlighted the significant disparities in access to care and outcomes, unfortunately, because of things like whether it be implicit bias or just geographic constraint or barriers. So absolutely a tremendous challenge. And I don't know that I can solve all of the issues that we face nationally or within the state or in specific counties. I can tell you some of the small examples of things that we've done. So we've partnered with the local community in Boulder County and public health to actually, when there was a real challenge around testing, and there still is, but it was a significant challenge, where we created a mobile testing unit. And so instead of saying, look, anyone can come to this, fourth floor parking garage and get your test, we're going to bring it to the vulnerable populations or those that we know that are disproportionately impacted or don't have access to this. And so we were able to bring testing to the homeless population or to other subgroups of our Boulder community that don't normally have access to things like testing. And ideally, that's probably the thing we're going to have to do with the vaccine. Like right now, we have created this vaccine site, and you're right. One of the reasons that we were able to move pretty quickly is back in July when they were still available, we bought 2 freezers that go down to minus 80 degrees. Most people, there's probably entire counties that don't have a freezer there that goes to that level that can store the Pfizer vaccine and allow for a vaccination within that community, until you get to Moderna or others. So there are definitely some clear supply chain issues we're all experiencing, but are exacerbated in certain parts of our state. But what I'm hoping is this exposes some of these challenges and it elevates them to the point that we create some sustainable solutions. I hope this is the last pandemic like this, but that's improbable. But I can tell you it's not the last challenge that we're going to face or feel in terms of our health system, and in particular our public health system. And ideally, this is a real call to support and build those things up and absolutely address the inequities that unfortunately we see every day. And everywhere. You don't have to go rural. You don't have to go to a downtown metropolitan area. I can tell you they're right here in Boulder and Boulder County.
So we're receiving a lot of questions regarding the vaccination. I encourage everybody to go to bch.org. There's very extensive information on our homepage regarding availability and all of our FAQs. So please check out bch.org, O-R-G, when you get a chance to learn more on that specifically. This is kind of an interesting one, as going back to the question about telehealth, earlier. There was a big push on shifting to telehealth, throughout the pandemic, which really was accelerated in much in part due to reimbursements that now are enabled through various insurance companies. But one of the questions that somebody had is on outcomes. We're seeing a much higher proportion of behavioral health, as an example, lead to telehealth now. I'm curious, Dr. Vissers, what your thoughts are broadly, I guess, in terms of changes in outcomes and how you want to monitor that.
You're speaking in terms of the impact of telehealth itself?
I guess think with the shift to telehealth and moving a number of specialty services over to that platform, are you seeing differences in outcomes? And as CEO of BCH, what are the key things that you're kind of looking at as you kind of determine how fast to accelerate this in the months and years ahead?
That's a great question. And I think time will tell, but there are variants that may dictate what this shows, but also I think we just know based on human behavior, perhaps how this could potentially play out. But prior to the pandemic, the British Health Services system was very aggressively utilizing telehealth to address their mental health issues. And interestingly enough, what they found was they had better outcomes. And they think some of it in part was the accessibility. Some people appreciated the relative anonymity and the ability to engage in both a group setting and individual care. But also they combined that with managing their medical health through a virtual space. And so addressing those two things. So there is an example, at least in a fairly large system, where they've seen better outcomes. I can tell you that the reason we're not going back to all in-person care is that many of you on this who experienced virtual health said, I like it better. And anything that improves the patient experience, your ability to access that care in a timely fashion and in a way that works for you, is going to increase your compliance, is going to increase your engagement, is going to increase your participation in the care and hopefully the outcome. And so I think for a significant part of our population, this will be the preferred and meaningful way for you to receive care. One of the challenges in healthcare is there's a bit of sadly, a paternalistic view about we're here to deliver the care in the way that I feel you should get it. and it's up to you to participate or not. But we need to flip that around. What can I do to deliver the care to you in a way that's meaningful, that addresses not only your health needs, but your ability to receive that care, and whether it's a language barrier or whether it's a social disparity or something. And so I actually think virtual health is a way for us to address some of those inequities and increase and improve our outcomes if we do it thoughtfully. It's not going to replace things. I see it as an improvement and a potential addition.
Excellent. We're getting a lot of questions, so my head is swimming in different topics here. So I'm trying to get through a few additional ones before we close up here at 6:30.
If you want to look at a few things, I just want to chime in on the vaccination stuff a little bit,
Sure.
Because I am very proud of the efforts of the healthcare systems and the hospitals. And one of the outcomes has been the hospitals working very closely together and partnering to really work towards a public health outcome. At BCH, we have provided over half the vaccinations in Boulder County. I think we're over 14,000 now. We would love to do more. It's a supply issue. And as much as it's frustrating and challenging for everybody, 1 week we will get up to 2,000 or 3,000 doses. We have the ability to do 10,000 a week through the clinic we've established. This week we got 300. It's very difficult to do something in a consistent manner, as you all know, those of you that are in businesses, when you have no idea what your supply is day to day or week to week. If we can solve that, again, through hopefully some national and state leadership, we can vaccinate. We're there to support, and we can vaccinate this community. And right now, that's the way we get out of this pandemic. Behavior is absolutely critical and important until we get there. But that's the way we get out of this economically and how we get out of it from a public health point of view.
So, Phil, can you take that message back to the governor for us? Send more. We'll ramp up as received.
I will take that message back, and I think part of the challenge, just to be totally candid, is states are good at some things. The federal government is good at other things. States are not the ideal driver of vaccine production. That's what we have the Defense Production Act for. I don't have enough visibility on the supply chains. I recognize there's some constraints that are going to be difficult. There's a good article about how Pfizer dealt with all their supply chain constraints. So some of it is endemic. As for what could have been done better up till now, that's probably worth waiting to deal with later. I think it's fair to say we got to do all we can to get as much vaccines out there as possible.
Yeah, I'm pretty sure the governor's actually tired of hearing from me and all of us, but I know that they're working very hard because sadly he's stuck with a limited supply as well. And I think that's what we're seeing this week is a lack of supply from the federal end. Complex issue, hopefully something that we can solve going forward.
All right. I'm going to switch topics a little bit back to something I know, Bill, that you're very passionate about. So on the opioid crisis and reduction, you mentioned the Purdue Pharma, suit and settlement that occurred on that. How are those dollars going to get down to the local level and to local solutions? What is the process for that?
We're negotiating, and the framework is going to have the vast majority funds will be at the local and regional level. And what that will mean is Boulder County will probably have, like the public health department there or whatever the right agency is, an ability to work with its municipal partners. So you've got City of Boulder plus Boulder County, plus you've got some other jurisdictions. Ideally, you'll have as much collaboration as possible. So the City of Louisville or City of Superior probably shouldn't be running their own drug treatment programs. They probably should leverage off the county. So the idea is to get that pooled at a reasonable regional level, get as much money at that level as possible, and then let that body make decisions about who to partner with, how to invest the funds. I do not want to be directing that from a state level because every county and every regional area is going to be different.
All right, very helpful. Thank you for addressing that. Somebody asked a question earlier if BCH is part of UC Health. We actually partner with UC Health in a number of ways, but we actually are independent health system, and we're actually one of two independent health systems on the Front Range. So it's us and Parkview, down in Pueblo. So a question to the Attorney General is, can you share a little bit more about what you're doing to protect both the independence of the remaining independents that are out there, as well as the rural hospitals that are facing so many challenges right now? I spoke to you a little bit earlier, but maybe a little bit deeper.
Well, I talked about rural hospitals. I can talk more about that, but let me talk about the dynamics of the marketplace. There have been a lot of studies about, and we didn't talk about it earlier, so I'm glad to talk about it now, healthcare costs. One of the best ways to manage healthcare costs is competition. When you have competition between hospitals, between hospital systems, between insurance plans, that's better for consumers. Consumers have choice. Competition keeps entities on their toes. I believe in that system. The antitrust laws are a way to ensure we have competition and that we don't have anti-competitive arrangements. So I'll give you an example. We reviewed a merger between a clinical provider group, DaVita, that was going to merge with United Healthcare, which is an insurer. And what that was going to do is take away a main source of supply to one of the rivals to United Healthcare. This was in Colorado Springs, where United Healthcare had the lion's share of the Medicare Advantage market. But Humana had been an upstart building up market share, largely at the expense of the dominant firm, United Healthcare. United Healthcare goes to buy this DaVita clinics. That was going to hurt the rival, Humana. We stepped in and said, not so fast. We came up with a solution because we were ready to block the merger to protect competition so that we wouldn't have a dominant firm using anti-competitive arrangements to limit competition. Anytime there are efforts to limit competition, whether exclusive dealing or it could be mergers and acquisitions, we are there on the front lines to protect competition. And so it's very important that as we see these threats, we are able to investigate them, work with our federal partners, and protect consumers. The other thing I would say about cost is technology. And this is an area where sometimes independence can be even a leader. We talked about telehealth. That lowers the cost of healthcare. That's a great technological change. Another big area is things like people getting more personal information, whether it's using MyChart or whether it's getting personal health information so people can have more ability to say, I've got these symptoms, what else could I do? And that is an area that we in Colorado can be a leader on, and I'm excited to see that go forward.
I guess I will add on. So first of all, we have relationships with many other healthcare entities, and one of the strengths of the Front Range is, well, it's a very competitive market. You have at least 5 large state or national systems here, as well as, unfortunately, only a few independents left. But if anything, this COVID crisis has accelerated our ability to work collaboratively and partner and work towards the better outcome of Coloradans as a group. The reason we are committed to staying independent is that when we look at it, and when you're acquired, 2 things happen to the care in the community. The cost goes up and the quality goes down. And so to Phil's point, our ability to stay independent, we see that as key to serve and better the health of our community. And that's why we're staying on that path. There's certainly a more financially rewarding path to take, but that would not serve the community. And that's not the direction that we have to go or need to go, but certainly don't want to go. So I'm glad someone brought that up. I also think that our size gave us the nimbleness in this past year to respond to this crisis in a way that I don't think we could have if we were part of a much bigger system, certainly not if we were part of a national chain or a for-profit system.
Yeah, that's a great point, Rob. I'm going to try to sneak in one more question here. If you talk to any healthcare consultant out there, one of the top three risks that they'll mention today is cybersecurity. That wasn't even on that top 3 list 2 years ago, 3 years ago, 4 years ago. Bill, I assume that you're looking at cybersecurity in so many different ways right now. Could you speak to that a little bit?
I mentioned my background's in technology. When I worked in the Obama White House, we were working on this issue, and we saw the threat that this poses. Any hospital right now is thinking about the risks, including someone literally taking over and locking down your data. There's a range of risks that all hospitals face around healthcare data, and there's federal oversight that requires moving to best practice. In Colorado, we have oversight as well. There's a state law, and if there's a data breach, data is taken, we need to learn about it. And the question always is, was the person who had the data taking reasonable precautions to protect the data? And so we try to educate up front for all sorts of businesses. Here's what you need to know about how you protect your data, either as a consumer, as a small business, as a healthcare provider. And if there's someone who engages in reckless behavior, think about what happened with Equifax, for example, we will go after them and we will try to get funds from that. And we then reinvest those funds in cybersecurity. We're actually supporting a new cybersecurity program up in Northwest Colorado to ensure that we have more cybersecurity professionals, because that's one of the big challenges. We don't have enough people in this area. So we're working on this from a range of efforts: prevention, going after entities who are irresponsible, trying to invest in raising the level of practice. There's a big set of risks here, particularly in the healthcare sector, and I'm glad you raised it.
Rob,
Interestingly, I was in a CEO panel pre-COVID again, and these were CEOs from all around the country, and they had to list their top 3 issues. And consistently within the top 3, for some of them, it was cybersecurity. So incredibly important. Your healthcare information is precious, and it's considered very valuable out on the market. And so protecting that is absolutely a priority.
So Phil and Rob, I know you've been seeing all these questions come in. How about I give each of you guys a minute or so, I guess, with any closing remarks that you have on our conversation tonight, or any of these other topics that have come up that you want to address also. Yeah. Phil, would you like to go first?
I would. I want to thank you, Grant. I want to thank you, Rob, for this opportunity. Part of what this discussion has underscored is this collaboration point that we've come back to again and again. Colorado is fortunate that's a part of our culture. That is how we roll here. On healthcare, as we've discussed, there's so many ways we need government, we need healthcare providers, we need schools, the private sector working together. There is, to my mind, a range of areas that we can do better in, and we need to take a look in the mirror during COVID, after COVID, at our mental health system, at our criminal justice system, and keep asking, how can we do better? That's part of our spirit as well. We're not just collaborative, but we're innovative. We're always asking, how can we improve? And as your Attorney General, I view my role is to serve the people of Colorado, all of Colorado, in the spirit of Colorado. And that's critical in this healthcare area, and I really appreciate your leadership and today's chance to visit.
Attorney General Weiser, thank you. Dr. Vissers?
You know, if there's a theme that comes through here, and some of it's around access, some of it's around affordability, but if we back up a little bit, if anything, what this past year has taught us is that healthcare isn't just addressing the loss of your health, mitigating pain, or resolving and curing a disease, but it's actually building and not only preventing that, but creating health within our entire community, and how critical it is how our individual actions and how we work together impacts the entire health of not just our community, not just the Front Range, but the entire state as well. And it's demonstrated to me, some really important lessons about how critical it is, not just even for providers within a system or the docs that take care for you work together, but how we work with public health, how we work with our legislators, our lawmakers, our law enforcers. And that really is what drives the overall health of Colorado. And we should be proud of how we're performing as a state pre-COVID, during, and I know post-COVID. There's a reason that we're considered the healthiest state. And it isn't just because it's so wonderful and you just want to get outside and it's active. That's a big part of it. But a lot of it is the behavior of people on the call and the collaboration of not just docs and providers, but leaders within our state, like Phil, and that they see their job as much more than that particular role, but having a duty towards the entire the public health of the community. So a lot of great lessons learned, and I know we're going to get through this, and we're going to be better for it. And I look forward to the next several years where we continue to tackle the mental health challenges we face and the opioid crisis that we'll continue to face, and be better prepared for the next health crisis or pandemic that faces us. So very optimistic as well. And thank you for all that you've done, Phil, to support these efforts and to protect us against some of the challenges that we face as well.
I so appreciate the spirit of collaboration that you both raised. You know, if you look at from the beginning of the pandemic to where we are, is collaboration across so many different fronts that have enabled us to be as successful as we have been, I guess, in terms of addressing, taking on the barriers, providing the best treatment to care, and getting to the other side of this. So I just wanted to thank all the 500 people that registered for tonight's event, for all you have done to collaborate with us, you know, throughout this process. I think I can speak on behalf of, you know, over 2,000 nurses and physicians, nurses aides and EBS employees and others at BCH, how much we have appreciated the outpouring of community support that we have received. That has come in masks, that has come in food, that has come in donations, that has come in signage, that has come in howling at the moon and clanking of hands. And now it comes with, you know, finding our way to the other end of those through vaccinations. So I appreciate everybody's interest in that and all that you've done in support of us. Big thanks to Attorney General Phil Weiser and to Dr. Vissers. I know you're both incredibly busy, but I appreciate you coming tonight for a little fireside chat, I guess. And I wish you both well, and thank you to our audience for attending. And again, one last reminder, all things vaccination, go to bch.org, and lots of good information there on our process and next steps. So please take advantage of the resource. Again, thank you, everybody.
Thanks, everybody. Real pleasure.